And welcome to the Shatkin First Monday Morning Minute.
Good morning, and I'm Dr. Todd Shatkin, and welcome to this Monday Morning Minute. Today we're going to be removing a bridge on top of 4 mini implants. It's teeth number 28, 29, and 30. We did this work back in 2019, and he was doing fine for many years, but recently started to feel a little bit of movement of the bridge. And when we took an x-ray here, John, you can see there's a hairline crack on the distal implant here, which is very unusual, but occasionally can happen. Mini implants can crack. Conventional implants can crack. Very often the small screw that retains the crowns on conventional implants will crack. And in fact, I just had to remove one of those the other day. So the human jaw is very, very strong with the musculature, and the amount of biting force it puts on these implants is sometimes enormous, and it can cause this to happen once in a while. Over time, the metal can fatigue. So again, this is 5 years, almost 6 years old, and he's got this problem here. So there's a little bit of a rock to the bridge, and what I'm going to try to do, I've already anesthetized him. What I'm going to try to do this morning is try to tap the bridge off if I can and get the bridge out without removing any of the implants, hopefully, and having no more fractures. But what I can see on the x-ray is the one has a crack, but it's possible that there might be a crack on the other one too. So let's give it a try, okay? So I'm using the crown tapper that I've talked about before. This is made by Carl Schumacher. It's one of my favorite instruments. You just pop and pops the crowns off, okay? So my patient here, Thomas, has been nice enough to let us record this. So I'm going to go ahead and give it a try, okay, Tom?
Okay.
If anything bothers you, you let me know. You shouldn't feel any pain, just tapping and pressure, okay? Let's see if we can get under there. Well, it's not on. Let's see. Okay, here we go. Okay, we got it. So fortunately, exactly what I wanted to happen happened. The implant that was broken came out in the bridge, but the rest of the implants look solid, and they are. So there's the 3 implants, and those implants are nice and solid. So fortunately, the only implant that had broken was that back one, Tom, so that's good. Mm-hmm. So in this case, what I normally do, I prefer to leave the fragment in there because it's not going to cause any problems for you. I'd rather leave the piece in there and work around it and add one more implant. But if you prefer, we can open up the gum and surgically remove the broken implant. That's totally up to you. We'd have to make an incision, open up the gum, and cut some bone around the implant, and then wiggle it out, and then suture it up, and then we can put an implant in later. But right now, in my opinion, if you were my brother, I would say leave it and let's work around it. That's my opinion.
Yeah. I think that makes good sense. What about down the road? That's concern.
Well, like I said, I don't think you'll ever have a problem with the implant being in there. It just doesn't cause problems.
Makes sense to me.
I've done this several dozen times and I've never seen any real issue.
Okay, it makes sense to me to just put a new
All right,
post
so I'm going to add one additional implant. Okay, sir?
Yeah.
All right. The implants shouldn't break like that, but it's just an unusual thing. Occasionally it does happen.
Yeah.
You do have pretty strong muscles here. Bite together, clench. See, he's got very strong masseter muscles, and open for me, and you can see he's chipping away at his teeth. He's grinding away at these teeth, so he is a grinder and a clencher, and I'm 90% sure that's the reason this happened, because you're probably not even realizing it, but when you sleep at night, you're probably grinding your teeth. That's why these teeth are all chipping here.
I wouldn't know. I'm sleeping.
Yeah, you're sleeping, I know. But I'm just saying that's over the years, this is what's happened, and that's most likely why that back molar chipped.
Good assumption.
The implant broke.
I only have a 10 or 15.
All right, we're just going to put one implant just distal to the one that came out. You able to get it? Hold the lip down. So
Yep.
You getting this, John? Really? Are you getting it, John?
Yeah.
Really? Okay, I made my pilot hole. You can see a little bit of bone on the pilot drill. That's a good sign. All
Does
right.
it have auto stop on it?
I stop it. It beeps so that I know how the density of the bone is. Hear the beeping sound?
Uh-huh.
That's the sound we like to hear. That's like your auto stop. That tells us that we've got enough torque in the bone and we can stop putting it in. Okay? So now we've got our additional implant placed just distal to where the one came out. Are you able to see that, John? All right, very good. So I'm not worried about that little angulation because I purposely angled it a little toward the distal in order to grab enough solid bone. And we're good there. I'm just going to go one more turn. Okay, good. Very good. All right.
That went in so easy, painless. Didn't
Good.
even know you put it in.
Yeah, excellent. And now we're going to take an impression to make your new bridge, okay? Let me go ahead and... That bridge was so nice. I am going to give it a try at making space for the implant in it, if possible. So I'll show you another trick that sometimes works. Okay, we're going to take the impression. This is the Kettenbach impression material, Bite Together. I talk about it a lot. I really like this product. It's very hydrophilic, very easy to work with. Put your lips together. Just hold that for 3 minutes, okay? All right. So what I'm doing now is just taking the implant out of the bridge. Let's see if we can get that out. Okay. So we got that broken piece out. And the new implant I placed distal. So I'm just going to see, it may not be possible, but I'm going to see if I can hollow out the bridge enough to fit over the new implant, but it may be too far distal and we may have to make a new one, which is no big deal. So I basically took off the whole distal part of the pontic to see if there's enough room for the new implant to fit inside there. Also going to clean out the cement from the other holes. It's a messy job, but somebody's got to do it. All right, we're going to keep biting. Oh, keep biting. What's that?
It's probably fine.
Keep biting. All right, it's all set. Okay, open. All right. Okay, there's our impression. Got a nice impression there. You make a good first impression, Tom.
Well, praise God for that.
All right, let me try this in and see where we're at. Well, we are very lucky. I was able to hollow that out enough to go ahead and cement your bridge back in. Open for me, so that's great. Let's see. It's pretty good. I don't know how we got so lucky there, but we did. Looks fabulous. Okay. We'll go ahead and cement that. We're going to go ahead and cement that back in with the Shatkin first cement. We're going to put that in the holes. And also going to fill this area with the cement. Okay, and bite together. Hold that for 3 more minutes, okay? Okay, it's nice and solid. It's not rocking anymore. Let me just check the bite. You floss the front. Let's see. Good. Looks great. Let's see. Bite together. Open. Bite together. Open. It is hitting a little bit heavy on the back, so I'm going to just do a little adjustment of the bite. Let's check it one more time. Bite together. Open. Still hitting a little heavy on the back. Okay, and bite again. Open. Still hitting on that last tooth. Maybe that was the issue, but bite again. A little bit more. And bite. Open. Okay, good. I think we got it. Does that feel pretty good?
Yep.
All right, we're going to get a post-op x-ray, but you're all set. All right, so thank you for joining us on this Monday Morning Minute. As you saw, occasionally we do have implants that fail. In this case, the 1 out of the 4 implants fractured at the just below the crest of the ridge, and the other 3 implants were solid. I was able to remove the bridge, take the implant out of the bridge, place another mini implant, and retrofit the bridge by hollowing out just distal to the existing implant. Quick, easy fix. The bridge is intact. It's in his mouth. It looks great. Should be good for many more years. All right, Tom, thank you very much for joining us on the Monday Morning Minute.
Thank you.
I'll see you next time on the Monday Morning Minute. I'm Dr. Todd Shatkin.
Join Dr. Todd Shatkin and Dr. Gordon Christensen for our 3-day advanced mini dental implant course on March 27th through the 29th here at our headquarters in Buffalo, New York. Watch Dr. Shatkin do live surgery, and you can listen to the experts while earning up to 24 CE credits. We'll also be covering case selection, placement techniques, and marketing strategies to help you grow your business. Our 3rd optional day will be with Dr. Samuel Shatkin, MD. He will be training dentists on how to use Botox to calm the masseter muscle down. And it's an absolute awesome course because Dr. Sam will actually lecture, and we will have the opportunity for dentists to place the Botox on live patients. Spaces are limited, so sign up at shatkinfirst.com today or call 716-839-2959. And we look forward to seeing everyone in Buffalo for this advanced mini and mono dental implant course tied in with Botox.